Dealing with depression can be difficult, not only for those who suffer with the illness, but also for their families and their friends. Navigating through the maze of treatment methods and providers can also be overwhelming in itself. TMS Health Solutions provides a non-invasive procedure to treat depression, anxiety, and other emotional conditions. And here to explain more about the process is Dr. Karl Lanocha. He's MD, along with patient Veronica Clark. And a warm welcome to both of you.
Good morning. Thank you.
Good morning. Good morning. So doctor, tell us, what causes depression in people?
Well, clinical depression is usually caused by a combination of factors. Some of them are genetic and some of them are environmental. Everyone feels sad from time to time, but clinical depression goes beyond normal sadness and affects how a person not only feels, but also their sleep, appetite, and behavior. Some people do have a genetic predisposition to depression, but anyone can develop clinical depression in response to certain life stresses. The loss of a loved one, the loss of a job, the loss of physical health are some of the more common causes that we see. But whatever the cause of the depression might be, we know that there are certain areas of the brain that are not functioning properly.
Okay. Now, what is TMS?
TMS stands for transcranial magnetic stimulation.
Okay.
And this is a safe, non-invasive treatment that uses a strong magnetic field to stimulate a specific part of the brain. We do the treatment right in the office using a safe, FDA-approved electromagnet, which rests on the left side of the brain, close to the forehead. Over the course of several weeks, repeated stimulation with the magnet restores this area of the brain to a normal level of functioning.
Oh, wow. Okay.
Yes.
So tell me about your experience, though, with TMS therapy. Would you say it's successful?
Well, I can tell you that I was one of the first doctors in the country to begin using the treatment when it was first approved by the FDA. And I believe that it truly is a revolution in the treatment of depression.
Really? Wow. And obviously this is an alternative compared to medication, which a lot of people are very familiar with. And Veronica, you've had the TMS therapy.
Yes.
Yeah, so tell me about your experience. I mean, how has your life changed and how are you feeling?
Well, there is a drastic change in my life from now compared to before I had the treatment. Before the treatment, it was difficult to function on a daily basis. I would do only what I had to absolutely do to provide for my family.
Yeah.
I would stay in my room a lot. I would sleep most of the day, all weekend. I wasn't part of my kids' lives. I stopped cooking, I stopped cleaning. Well, now, I didn't have energy. Well, now I smile more. I can joke around. You know, my coworkers have noticed. My family has noticed that even my face looks different because the TMS actually helped activate my smile muscles.
All right.
I mean, a drastic difference. I wake up now with hope. And I normally, before the TMS, I would have been happy. I should have been happy.
Yeah.
I have 2 healthy kids. My husband takes good care of me, you know.
Yeah.
But now I'm able to kind of return the favor. My kids are excited. There's just a drastic difference. I can enjoy life now.
Yeah, it sounds like that this is a very, very positive therapy for you.
Yes,
Things are working
incredible.
Really well. So doctor, tell me, what is the outcome for TMS therapy, percentage-wise, versus meds?
Well, studies have shown that only about 1/3 of people get completely better with the first antidepressant medicine they try. And after that, the likelihood of achieving remission decreases. So if someone has failed to respond to 3 antidepressants, the likelihood of them getting better drops to less than 10%.
Wow.
In clinical studies, what we have typically seen is that about 2/3 of patients will experience significant improvement and about 1/3 will achieve full remission. But in real life, everyday clinical practice, we typically see much better response rates, with about 80% of people experiencing significant improvement and about 2/3 having their depression go away completely.
Wow, okay. And when it comes to seeing the results, how quickly do clients actually start to feel a bit of a difference?
Well, TMS works by turning on an area of the brain that has been underactive for a long time. And that takes a little time in itself. So most people really don't start to notice much until they've had about 15 or 20 treatments. And most people need about 30 to 35 treatments to get the full effect.
Okay. So to make sure that you're diligent and that you're following through with this and continuing with your treatment is probably the best approach. So what is the process, though, of TMS therapy? Exactly how does this fully work? Can you explain that? And has it been tested?
Oh, absolutely. TMS was originally developed as a research tool, and the fact that it can even be used to treat depression was discovered accidentally in the 1990s. But there have been hundreds of papers published in medical journals around the world demonstrating the effectiveness of TMS in treating depression. In 2008, the FDA approved TMS in this country based on a large study that involved several hundred patients at 20 clinical sites around the world. And since then, those findings have been replicated several times.
Oh, wow. Okay. And Veronica, in your situation, is there anything that you would like our viewers to know about TMS? Is this something that you'd recommend?
I highly recommend it. Now, I had been through a course of several medications before this, and if for anyone who's gone through changes in medication, it's very difficult. I recommend checking out TMS, you know, talking to the doctors, seeing if it's a possible solution for them, because if there's any way that it could help anyone who's suffering the way I did, they really owe it to themselves and their loved ones to check it out and have some hope, because it really could help improve life.
Yeah, and clearly your life is much better having done this.
It's incredible. Yeah. I'm so thankful I found out about it and that I had it.
Wonderful. And doctor, where do people go for more information about this?
I believe that there is a phone number and a website on the screen, and you can contact us through either approach.
Okay, all right, so give them a call or check out them online, everybody. Thank you both so much. Really appreciate you joining us.
Thank you so much.